So Andy, tell me about the new name change here at Campbell County Health and how that transpired.
Well, we felt like our name needed to reflect the vast array of services that we provide, Joe. We began years ago as a hospital, but we're no longer only a hospital. We've got a number of services that we've added through the years to try and provide more services to Campbell County and be able to ensure that those services survive, that they weren't dependent on some other entity from outside of Gillette or Campbell County. And so for that reason, we felt it was time for us to have a name change that reflected the services that we provide. And Campbell County Health seemed to be an adequate descriptor of those services. So we're excited about that change. We think it's good, and it allows us to present ourselves to our community in a way that really describes who we are now and who we expect to continue to evolve to in the future, which is more of a healthcare system.
What are some of the challenges with changing your name? I mean, obviously, business cards and websites and all that stuff has to be changed. Well, in terms of branding and marketing that to the public, what's unique about that? Well,
there is a lot to think of, and to be frank with you, every day we find one more thing that we probably didn't think of because it involves so many different elements of your organization. So there is a lot to do. We're trying to phase it in such a way that it isn't overly expensive. We didn't pay a lot for a big name change campaign. We think we went about it in a reasonable way, and we came up with a name that really fits who we are in the community. And so for that, all of that, I think it's been a good process for us, but it continues to be a process. We have a lot to do. I suspect it will take the better part of this fiscal year, which for us begins now and runs through next June. And during that time period, we'll change out, as you mentioned, stationery and email addresses and signage and so forth. We also, as you mentioned, want to present ourselves to the community because we do believe we're changing and for the better. And so it gives us that opportunity to re-announce ourselves, I guess, to the community as the provider of many healthcare services in Gillette and Campbell County, not just a hospital. So we're going to take that opportunity. We'll be doing some marketing. We're doing some video and radio and billboards and lots of different types of media in order to let people know that the name change is only the beginning.
Gotcha. Let's talk about the sort of the perception change. I think seems like when I used to film the meetings a while back, the patient satisfaction surveys were pretty important to you guys. How are you utilizing those in this sort of being a new health facility and kind of having people think about this facility and facilities differently?
Well, we're very focused on patient satisfaction. In fact, we do patient satisfaction surveys for our inpatients, for all of our outpatients, which includes dialysis, cancer care, surgery, lab, radiology. We do a focused patient satisfaction survey for the emergency room patients. Now we're doing them for all of our clinics, and there are 14 or so clinics. We do a separate satisfaction survey for our residents at Pioneer Manor. So we are extremely focused on that. In fact, it's front and center on our strategic plan. And we use that data to look at particular areas where we can improve and need to improve. We also use it to celebrate. This year, we've seen a very measurable, meaningful, and exciting increase in our inpatient satisfaction surveys. So we're going to be talking about that more. And then we have other areas that are more of a challenge to us, so we set goals to improve in those areas. So it's extremely important what we do. We share it with our board. We have it, I'm evaluated on it personally, and my managers, my vice presidents, use that data for their evaluation, so it has a lot of impact throughout the organization. We're extremely focused on all kinds of patient satisfaction. In fact, we do internal customer satisfaction surveys. So I get to evaluate our housekeeping department, and all of our managers evaluate nutrition services and human resources as a department. So whether it's in the clinical area or in the support departments, we're very focused on improving our service to our patients and even to ourselves internally.
How important are these surveys to judging how you're doing under the Affordable Care Act and Obamacare? Do they carry some weight with those?
Absolutely they do. In fact, that's why while we have all those, the inpatient, the outpatient, emergency department, and long-term care, those are all in our strategic plan. We've been probably a little more focused, in all honesty, in the last year or so on our inpatient, and the reason is because Medicare, CMS, the Centers for Medicare and Medicaid Services, several years ago decided that they would begin to either lower or increase the payment to us for our inpatient services based in part on those service scores. So they're very meaningful. We stand to either lose some payment from Medicare or in fact gain some payment from Medicare based on how our patients, on how those scores come out for us. So it's very important for us, and in the future emergency department scores are going to carry that same kind of weight, and then the clinics, they're going to evaluate physician clinics, not just our clinics but independent physicians, and then eventually long-term care and other outpatient departments. So it's very meaningful. It has a, not only do you look at it and adjudicate yourself based on how well patients perceive that you did, but now there's a financial impact for us, so obviously it's extremely important.
Gotcha. What, if you can just give me one of the strengths that come out of the survey and maybe one area that needs improvement?
Okay. Well, the inpatient, we started this last year, about a year ago at this time when we were surveying, our inpatient department, and I'm talking about medical surgical area, ICU, and women's services. Those areas were generally below the 50th percentile in the country, and some of them lower than that. These last 2 quarters of our fiscal year, we've been anywhere from at least above the 50th percentile to the top 5th percentile in the country. So we've seen some monumental increases, and we're extremely excited about that. So that's a success, and we intend to focus on that and maintain that level of excellence. Emergency department, as an example, is an area where we're going to be focusing this next year, where we feel like we can improve. And so we have that again as a measurement on our strategic plan. And so there are several questions they ask, that CMS ask in the emergency department as a part of that survey, and we will focus on all of those areas to ensure that our customers are getting adequate pain control, that they're being served timely, that they're given compassionate care, and those are the kinds of things that are asked on the survey. So we're not just going to put a blanket statement out there. We intend to get it better at our emergency department. We'll actually employ tactics to try and improve in those specific areas so we can see some objective increase and impact for our customers, because we want to take better care of them all the time, and we want them to know that we do care about them, we do care about their pain, we do care about their timeliness of their service and the quality of the outcome that they receive. So we want them to feel like when they get surveyed that they can feel good about giving us an always score is what we're after, that we always take good care of them. That's our goal.
Andy, tell me what some of the services Campbell County Health provides that might not be found or are kind of rare in the rest of the state.
Well, that's a great question, because it really feeds into our name change, Campbell County Health. You asked that a little earlier. We are the most comprehensive healthcare provider in Wyoming, and I tell people that, and oftentimes it's surprising, or perhaps they don't even believe me. But we provide an acute care hospital, obviously, and so does Casper, and so does Cheyenne, so does Cody, so does Sheridan. However, when you look at our array of services, we offer inpatient and outpatient behavioral health. We have a dialysis unit. We have medical and radiation oncology. We have home health. We have inpatient and outpatient hospice. We've got a great coordinated program with our local college for nurses, and we help fund that program. We've got a growing and a very highly qualified medical staff. When you look around the state, Joe, other hospitals don't have that same set of services. They may have a home health department, or they may offer medical oncology, or they may have a small outpatient behavioral unit, but they don't have what we have. What we have is truly unique, and we're able to provide that service, that set of services under one umbrella to our community. And what that means is we can coordinate those services much better. I just got a report several months ago from Medicare that said in Campbell County we have the lowest spending per beneficiary throughout the state of Wyoming, and far under the national average. I'm convinced that's at least in part because we coordinate that whole set of services for our patients and residents in the case of folks at Pioneer Manor. So it's truly a very unique, I believe, set of services that we offer in the state of Wyoming, and we're excited about even seeing that continue to grow in the future into more services.
Well, let me clear my throat. Let me follow up. What's next? What do you think the biggest service you could offer next is?
Well, we just recently added cardiac cath lab, and we have obviously some new cardiologists that we've recruited to our medical staff. So we're thrilled about that. That's got off to a great start. I mean, they are literally saving lives in Campbell County, and we're just thrilled that we're offering that service. So what we want to do is stabilize that. It's new. It's been a big challenge for us, and so rather than take another big bite out of the apple, so to speak, we want to focus on what we're doing now and do it in a very excellent, focused way. However, there are some things we want to do in the future. We believe that diabetes care is critical to the success of health in Campbell County. It's a huge problem nationally, and it's no different here in Campbell County. So on our strategic plan, we've got a new diabetic care program, and that means a range of services, both inpatient, outpatient, educational programs that we want to put together to see if we can't decrease the incidence of diabetes in our community and help those folks who have that disease better take care of themselves. So that's one thing. Along with that, and this has been in the paper, that we want to recruit an endocrinologist. That particular physician specialty will really help us take better care of the diabetic population. We don't currently have that in Campbell County, and we think it's critical to recruit that specialty. It's proven to be a real challenge for us. We're still working on it, but we're committed to bringing that service, probably on a part-time basis to begin with, to Campbell County to help us maximize what we want to do in the care of diabetes in our community. And so that's an example of one thing we're doing. Another example, we believe that the pediatric population is underserved. And so we've started a joint venture, a coordinated kids clinic with Campbell County School District. We're thrilled about that. We've got a great provider involved. We've got a great space that the school district has provided, and they've been a superior partner in this. So we hope this year, when school session starts here, coming up in a couple of weeks, that we really see that service grow, because we think it has the opportunity to help underserved children in Campbell County. So I think those are a couple of examples where we really feel we've still got opportunity to make a real improvement in the health care of Campbell County citizens, both young and old.
Excellent. Switching gears a bit, the long-term care facility, the Legacy Living and Rehabilitation Center, kind of had a difficult time getting that going. What's the status, and when do you expect that facility to break ground officially and do the ribbon cutting?
Well, the status is we're back under construction. I was over there just about a half an hour ago, out for lunch, and drove by there, and we're pouring footers and foundation so that it's well underway again. We have a great contractor or construction partner in Skull Construction out of Rapid City. They are also doing our imaging department and our physician clinic, but obviously the Legacy Living Center is a very big project. We feel great about that relationship with them. We're quite confident we're going to come in at or under budget. As far as the timeline, the projected substantial construction date, completion date, is November of 2015. So not quite a year and a half away. There are all sorts of things that make that date a little tenuous in my mind. One is we have to get state approval. So after the construction is done, the State Department of Health comes in and looks at the construction and tells us if there's anything that we need to fix. And generally in a project that large, there is some things that just maybe in their mind aren't quite right. Usually they're fairly small, but they can delay you a little bit and delay your ability to occupy that building. So we're hoping that nothing delays us, like weather or the state, but there's really no guarantee of that. So substantial completion is slated for November, December of 2015, when we'll actually be able to occupy that building. I hope is within 60 days of substantial completion, because even when you complete the construction, you've got to move in all the furniture, you've got to do a deep cleaning, you've got to test all the systems, and of course you have to move the residents. That all takes a little bit of time as well.
Now, let's talk about moving the residents. Are you moving all the residents? I guess initially there was some talk about, way back in the day, maybe some would move. Now are all moving to the new facility?
Yes, all will move. Currently we have about 110 to 115 residents at Pioneer Manor, and the vast majority of those are in long-term care. We generally run a census of about 5 or 6 in our rehab wing over there, but all of those patients and residents will move to Legacy Living Center, and they'll all have private rooms. They'll have obviously much increased space and services over there, so we think that'll be a very positive move. And there are, I'm sure, a few residents who really enjoy Pioneer Manor. They've been there a long time, and it's home to them. So we'll try to be extremely considerate and compassionate in that move, but we do plan to move all the residents, and how exactly that will happen and over what period of time, that plan we haven't worked out yet, but we'll be getting to work on that here pretty soon.
Gotcha. One final question. You were kind of doing a blog there for a while on social media about some of your experiences here. Can you tell me how you got involved and how the hospital is involved with social media and some of its outreach?
Well, social media is extremely important to us. Our marketing community relations department, we have a few folks there, one in particular who is extremely good with social media, and it was suggested to me that I should become a little more engaged with that. I personally am on Facebook and was familiar with that. The idea of me doing that as a CEO, once introduced to me, I kind of liked the idea, and so I took to it. And so I have about once or twice a month is what it amounts to. I've tried to do it every week, but in reality, probably a couple times a month. I write a blog, and sometimes I'll talk about my own personal surgical experience, which you alluded to. I've talked about other things. I'm going to be blogging on our name change here in either this week or next week. But just current things that are going on in the hospital. I once talked a little bit about my vacation with the idea that I encouraged our employees and medical staff to take time off and get away from work and decompress a little bit. So it's just a way for me, I guess, to connect in one more way through communication with our employees and let them know, just like them, I'm a human being, and these are the things I'm up to, and hopefully get some communication out about maybe what we're up to, like changing our name as an example. So I enjoy it. It's been good. I get some good feedback. Sometimes you communicate to an audience and you don't know what they're thinking. In social media, you tend to know what people are thinking, and I get some good feedback. I get a lot of likes, I get a lot of followers, And sometimes I get some tough questions from the things we talk about, and it allows us to give feedback to those folks and tell them, maybe a little bit more about what we're thinking and answer some of those questions. So I've enjoyed it, honestly. It's been good. And like I said, our marketing department has used social media in a very profound way. It's amazing to me, if you look back 5-10 years ago, where we are today with social media and the ability we have, we as an organization, the city or whoever, has to communicate really what's going on to their employees or to the broader public whom they serve. And so it's been good. I'm excited about social media in the future. It has its minefields. I think everybody's aware of that. But by and large, it's been a good forum, a good tool for us to communicate with.
All right. Andy Fitzgerald, thank you for your time today.
Well, thank you, Joe. Appreciate it.
You bet.